Hello, and welcome back to another episode of the Birth Lounge podcast. You guys, if you missed my announcement on Monday on social media, I'm pregnant! We are going to be welcoming baby HeHe into the world at the end of the year this year, and I'm so stoked for it, you guys. I'm so excited to finally be on this side of the aisle, and I'm so excited to be able to be on this journey with you guys. Tune in on Friday because I'm actually going to be breaking down all of the first trimester. I'm going to be talking about how we told our families and the team of practitioners that I have put together. So I'm so excited for that. But before we dive into my own pregnancy journey, I wanted to do an episode to catch you guys up about what is happening in our country when it comes to women's health and access to health care. We're going to start by unpacking the current postpartum landscape and what the most recent budget cuts and cuts to Medicaid actually mean for women and families and the access to health care that they may have. We're also going to talk about pivotal pieces of legislation that's being circulated in our country right now and how that may impact you and your family. I'm so excited to be having Natalie Davis join me on the show, who is the founder of United States of Care, which is an organization that ensures that everyone in our country has access to quality, affordable health care through community-driven policy change. Natalie is relentless in her person-centered approach to building healthcare solutions, and she has a long history of building partnerships that work to create positive change in our country's healthcare system. Need I say any more? I know that you already know exactly why I wanted to have her on the show. Natalie has served at the center of Medicare and Medicaid services. She helped implement the ACA, Affordable Care Act, and she has been a pioneer in helping bring forth the best innovations in care delivery models. I think Natalie's delivery in these very sensitive topics is so amazing because she does a really great job of keeping things bipartisan. Natalie's whole goal, and you can truly feel it in her presentation, is that no matter where you fall on the political spectrum, not only do you deserve access to affordable and quality health care, but you deserve to know what is going on in your country so you can be an informed voter and an informed consumer. Today's episode is going to be so critical in you becoming more informed in the things that are going on in our country, in your community, and right in your backyard so that you can stay in the know of what is changing in our healthcare landscape in our country. I'm so excited for this conversation because it's not something that I talk about often, and quite frankly, it's not something that I feel super equipped to talk about, and Natalie never made me feel like I didn't know what I was talking about. She explains things so beautifully and in terms that all of us can understand, and I hope that you walk away from this conversation feeling just as empowered as I did. All right, without further ado, Natalie, welcome to the show.
Thank you so much for having me. I'm excited to be here.
Thanks for being here. I'm excited for this conversation. It is an exciting conversation, but it's something that I think for so many women is just like, wah, wah. Yes, we've heard it a million times. We know that we are the forgotten gender. We know that we don't have the care, and it just sucks to have to come back to this conversation all the time to remind ourselves like there really is no support for women, which is really hard because I think so many of us want to be moms and we want to have children and we want to grow our families. But there is the other side of that thinking of like, how am I going to do that if I don't have any help? And if you're someone like you and I, and you have a good career that you love, and even more so if you've built it yourself and it's very much part of your identity,
becoming a mom can feel really tough. It can feel like a really tough decision because you know that part of that's going to be lost. You know that part of that is going to have to be given up to be
Yeah.
a mom and to have your baby. So before we get into the nitty-gritty of the United States of Care and all the good things that you guys are doing to move us forward, let's start with where we are in the US and what does our current postpartum care look like? What's the current state of maternal health after a baby in our country look like? And what are you hearing from women and new moms when it comes to access to care or lack thereof, really?
Yeah. Yeah. Well, again, thank you so much for having me and teeing up the conversation the way you just did, because you made it so clearly personal about what it's like to be a woman after you are no longer pregnant. We know that two-thirds of maternal deaths happen in that postpartum period. We know that women feel alone and sometimes can struggle with postpartum depression or other places of stress or mental health needs. We know that there's can be substance abuse that starts up again. And in the best case, we just feel like the candy wrapper that was thrown out after the candy came around. I've had four kids, and I know I certainly felt that way, and for the most part had a really good postpartum experience. But as we've talked to people and families and women across the country, it really is that period of time where when we think about that whole pregnancy, we usually just talk about 40 weeks. That is the very clinical pregnant to birth. And there's so much more than that. There's so much more to preconception. There's so much more to the time after you're no longer pregnant. And so we've talked about it as 100 weeks because it really is that period of time from conception to labor and delivery to that year postpartum that we know is so important for moms and for babies. And let's face it, communities function and run off of women and moms and families. And so we know this time is so important to make sure that women are getting what they need.
It's so funny to hear you say the communities run off of women and children because so much of that is unpaid labor, and we just don't think about the work that women do as, I think, valuable. But if you are a man that's at work and no one's doing your laundry at home, then you're not going to have anything to wear to work next week. If
Yeah.
no one is doing the grocery shopping, then you're either eating out every night or you're having to cook for yourself or you're not eating. It
Yeah.
is really the invisible labor that so many women do that go really unnoticed. So
Yeah, and in healthcare, you think about the mom as the healthcare CEO of the family. She's the one making
totally.
appointments, making sure that prescriptions are filled, forms are ready for school, sports. If something's wrong with a kid, bringing them to the ER in the middle of the night. And it's not to say that dads aren't helping with that, but a lot of the real nitty-gritty of making sure the family's staying healthy, and whether that's food, like you said, or appointments or insurance, really often does fall to the wife and the mom.
Yeah, they're like that household manager. I'm very lucky. I'm in a truly equal partnership. And I have a partner that's very involved. And we don't have any children right now, but he does the ER visits with our dog. And it's not uncommon for me to say, can you make this appointment? Or can you schedule this? Or can you run there? And so I'm super lucky, but I am acutely aware that I have something very special and that not a lot of people have that, especially. Just so many women don't have involved in equal partners. And I think a lot of men out there think that's normal. I think that they think this is how it's supposed to be and that they don't actually have a responsibility to necessarily be involved or be part of that management of the household.
Yeah, and I should say I also am very lucky. My husband actually is a stay-at-home dad, the lead parent for all four of
Nice.
our kids, and it is a blessing when it works out that way. And even still, I'm the one that makes sure that he brings him to the appointments, which I'm so thankful for because that's half the battle. There's so much else that goes into running the management of the healthcare of the family.
Yeah, things just work smoother when you have two adults that are doing it, right? And that's the whole point of the conversation is that when we're all working together, then things will be smoother. So speaking of working together, it can sometimes feel like our government is working against us, especially as women and especially lately. Can you tell us a little bit about how the recent budget cuts and maybe the cuts to Medicaid are actually going to impact women and families? I think there's a lot of really fear-based, scary things out there on the internet. They get sensationalized. You get it in 90-second clips. Really go deep. Help us understand as women, as those CEOs of our household, how is this going to impact us? And maybe if you could also break it down for people who are recipients of Medicaid versus people who are not recipients for Medicaid, because I feel like a lot of times it's very easy to have cognitive dissonance and you're like, I'm not on Medicaid, so that doesn't impact me. And I think you and I both know that's not true. That's just not how our US system is set up. It impacts everybody, every family, every woman, every child.
Yeah, I'm so glad you're bringing this up. It is such an important moment in for the health of our country. Like you said, Medicaid is so important to the health of our country, whether you're on it or not. The community around you is, the families are. It is our healthcare system, our insurance system is based off of Medicare. Simply, I can just put it this way, Medicare, which helps our older and sickest, Medicaid, which helps those that are working families, those that are trying to meet Medicaid is there for working families. There's those that are trying to have the day-to-day work meet the needs that they have with their healthcare needs and their food and their housing. It's so important for sick individuals in this country. It covers about half the births in this country, so it's so important for the health of our generations. And then the third part of insurance in our country is private insurance, those that get it through their employer. And so Medicaid covers huge amount of people in this country, making sure that they get not just emergency care, but preventive care, prenatal care, postpartum care, care for, as I said, the sickest, just sometimes just your run-of-the-mill healthcare that you need to stay healthy, and covers a huge amount of children in this country and making sure that they are healthy enough to live and prosper, to go to school, to keep down viruses, and just everything that a kid needs to be healthy in this country. And so right now, as you said, the Republicans in Congress who now are in charge, Trump and Congress made a big promise to not only cut the federal deficit, but to bring more tax breaks to people in this country. And so there's a large number out there, $880 billion that they want to find savings for. And if you look at the places that they're looking where they can make that money, you can't have those cuts without cutting Medicaid, if not other parts like Medicare and really important parts of our healthcare system. So that would mean that a lot of states where they've expanded Medicaid to cover more people through the Affordable Care Act. We know that 40 states have expanded Medicaid for postpartum coverage to make sure that women, before you would just have Medicaid coverage just weeks after birth, and now it's expanded to a year after birth. Benefits that people have to go see the dentist and to see others. We don't know what that'll look like, but to get that amount of savings, they will have to make a cut of benefits or of coverage or for working men, for postpartum women. And it's going to be a huge detriment to the health of this country. I don't think people who voted in members of Congress on either side voted in Trump. I don't think anybody gave that as a mandate to cut such an important part of our healthcare system. And so we're working really hard to make sure that members of Congress and others really hear from those that would be impacted or are worried about Medicaid cuts.
Yeah. So what would happen? I know you said we don't exactly know, but hypothetically, if you had to give it a guess, does this mean that those families just go without that care? Is that what we think? Or we think it's going to be limited, just very basic care that doesn't cover all of our healthcare needs? What do we think that's going to look like?
It probably will be a combination of cutting certain populations who have now been given such amazing healthcare coverage, like during COVID. There was a big push to have states, red, purple, blue states, expand that postpartum coverage for women a year after birth. You could see that sort of program going away. You could see in other states going after certain benefits to make sure that there still be enough coverage for enough people, but the coverage would be super limited, like maybe not dental and other kind of thought of as, I don't even want to use the words as extras because it's such important healthcare. But you could see them going after some populations and going after some benefits in order to meet the cuts that they've promised to the country. I'm hopeful that it won't happen. And there are some really valiant Republicans and Democrats, people on both sides of the aisle saying that we can't go backwards on this.
Yeah, I think it's pretty apparent we can't go backwards. And I'm also not surprised to hear that the programs that are funding women's health care are one of the ones that are going to be cut first and the most drastic. Again, it goes back to how I opened this episode. It's, ugh, we knew it was coming, but it still doesn't make it suck any less to know that we're in 2025 and we still can't get the respect of just having proper care after having such a major life event as having a baby. And that's for vaginal delivery. C-section delivery is even harder and it requires even longer recovery. It just is, it makes me, I feel frustrated and I also feel a little defeated, but then I have a lot of hope that people like you and just like people waking up to how abysmal our healthcare is in this country. I am very hopeful that people are going to step up on both sides and say, you know what? No, we have other cuts that we can make in other places, but it can't come from our healthcare system.
Yeah, I think that's right. And I can share with you another court case actually that our team is working on. It's now at the Supreme Court. We'll know in June or July. It's a court case called Braidwood versus Kennedy. And it is going after actually people who have health insurance through their employers. So if we have, that's about 160 million people, 23 million children. And this court case would take away all that free preventive services that all of us have gotten used to through our health insurance. So free cervical cancer screening. If we're thinking about moms in postpartum, it's the postpartum depression screening. It is mammograms. It's all, there's so many parts of the women's health that would now no longer be free and covered under our insurance because of a court case right now that's in front of the Supreme Court, which I can go into the wonky details of why it's really going after the authority of the federal government to require insurers to cover free preventive services. But it has made its way through the Fifth Circuit Court. It's a case we've been working on for years. We just recently submitted to the Supreme Court an amicus brief with 45 other organizations saying we can't go backwards. We can't have a place where these sort of things aren't free anymore. We know that cost is the number one barrier for people getting the health care that they need. And if we are now going back and saying you can't get postpartum screening unless you pay for it, I think we're going to go backwards in a huge way in this country. And if you put that with potential Medicaid cuts, nobody's unscathed, no family, no community. And there's a real threat. And we're working every day to make sure that doesn't happen.
Yeah, I'd love to hear some of the nitty-gritty details of that because, like you mentioned earlier, the most dangerous time is that postpartum period. We know that's when most maternal deaths happen, is after having a baby. So, yeah, if we are, and I'm in Massachusetts for any listeners that are new and just tuning in today, I'm based in Boston. And 2 years ago, we had that really tragic case of the Clancy family where the mom was not being followed by the appropriate healthcare team. And she had a large healthcare team, but there were so many gaps in her care. Nobody was doing overlap and it fell
Yeah.
through the cracks. And that family tragically lost all three of their children to postpartum mood disorder complications. It was really tragic for that community, but specifically our state. And I think it really did a great job in a tragic way of highlighting the necessity of following moms and giving them the appropriate care and making sure that you don't just have a healthcare team, you have the right healthcare team and that they're asking the right questions. They're doing the right screening. You are getting the right support. It all matters. Yeah, I'd love to hear the nitty-gritty of this case.
Yeah, and so I will give it to you, and then I want to pick up on some things that you're putting down.
Yeah.
So the court case basically is going after the authority of it's the body of experts. They're scientists. They've dedicated their whole lives to understanding evidence to make sure that we're doing good evidence-based medicine. And basically, they look at different screenings with that cervical cancer screening, postpartum depression screening, all post colorectal cancer screening, and they're the ones that look at all the evidence and say all of the studies that have been done on this, it is clear that men over 40 should have colorectal cancer screening. I'm just using that as an example every 2 years. So if you hear those sort of requirements or recommendations, they're called, from the United States Preventive Services Task Force, USPSTF, through the ACA, they were given the authority to say, to they're always grading the evidence, and they were given basically what they've graded as an A or B recommendation, something all of us should have. It's safe, it's effective. We have data to show the important age range, and that those recommendations that are scored an A and a B, meaning we should have them and the evidence is really strong, those are the ones that insurers are required to cover for free preventive services through the Affordable Care Act, and that's been in place now for over 15 years. So this court case is going after the authority of this body to make these recommendations, and that thus are what should be required from insurers. And basically saying that they're not members, they are not sworn in by Congress, they're not part of the Secretary's cabinet. But the whole point was for them to be an independent body that is not swayed by politics or by politicians. And
Money from lobbying or any of that.
yeah,
Yes.
exactly. Exactly. It's a very independent, established organization, a group of people. And so it's going at their authority to be able to be the ones that their grades are required for coverage. And so what this could look like is that now every state would have to go out and work with their insurers or every employer. This could become a triangle where insurers are going to have to figure out which states are requiring me to cover what, which employers want this, don't want this, and really creating, it's just going to be operationally just a disaster, and something our country said we really wanted to get away from, which was not having a federal floor of what everybody in this country should have in terms of free preventive services. So this is one, like I said, we're watching closely. We're making sure that the voice of people is brought to this Supreme Court case. We've done that too when it's been in Texas and in the Fifth Circuit, and really making sure that we don't go backwards and that people are able to get this life-saving care that we know that they often don't seek if it's not affordable.
Oh my gosh, it's so weird to see a country not want the best for their people. You already have it in place. It's already free,
Yeah,
which I understand. I know people are out there like nothing is ever free. I get that, but it's
right.
already allocated. The money's already there.
Already
We're
working.
already paying for it. Yes. Why would we ever take those services away if we actually care about the health and well-being of the kids and the women and the families in our country? That makes absolutely no sense to me. Okay, you said you had a couple of things to touch on. Do you want to
Yeah.
circle back to those thoughts?
Yeah, so this might be a good moment just to say a little bit of United States of Care. We are an advocacy organization that is nonpartisan, that brings the voice of people to the halls of power. We go out and talk to people across the country to find out where people agree on what they want out of the healthcare system, and then use that to change laws and regulations within states and in Congress and the administration. And so we've talked to over 30,000 people, over 5,000 hours. We have a database that houses all of these amazing insights into the human experience in the American healthcare system. And we're always looking for where do people agree across demographics, because we're told when you work in a political organization, we're always told that people, especially along political lines, but maybe race and ethnicity or income or geography, don't agree on what they want of the healthcare system, so don't even try. And we were founded to prove otherwise, that there are places that people agree, and there are really smart places that we should be focused on as a country. And when you mentioned that really tragic story, something that stood out for me is something that I hear often from people is that two things was we talk to people across the country. One is everybody feels like they're failing at healthcare. They know that the healthcare system isn't working, but they feel like they didn't pick the right doctor, the right insurance. They're not able to afford their copays. They can't stick with their prescriptions. They can't get to the gym. They have this genetic disorder that came through their family. And instead of really seeing that the healthcare system is failing all of us collectively, the story you told is one, as you just told it now, really shows that there's not coordination across providers. There's probably not listening to concerns from the woman or the family, that somebody has to, as we have talked to people, it's hacking the healthcare system. They've had to figure out all these things that work for them. If you can, ideally, you've been able to figure out something, but there isn't really this belief or understanding that there's a systemic failure, right? The system is failing people of what they need. And interestingly, when we talk to people of what fixes might look like, there's a feeling that you don't want the whole healthcare system burned down because it's too scary to think about what would be built back, that you'd lose your hacks, that you'd actually, when they rebuild it, they have my needs in mind and not industry or politicians. And so while there are so many people that believe and know that the healthcare system isn't working for them, it's really scary to think about it going away and what would be built back. And so, as we've talked to people, there's real appetite for targeted changes that really make a difference in their lives immediately now. Usually that looks like making healthcare more affordable. You can't talk to people across the country without hearing about, of course, how unaffordable it is. And a really important other areas that people have talked about they want fixed. It's making prescription drugs more affordable, supporting moms and babies during pregnancy and postpartum, better mental health, more care in the community, better access to virtual care and in-person care, and and more affordable insurance, especially if you can't get it through your employer. So a lot of solutions that people across demographics agree on, and those are the ones that we work on every day and talk to people like you about and to policymakers about to make sure that people really understand that there's a collective experience. And what's interesting is now we're starting to see people wake up to the idea that this is a collective failure. With the horrendous murder of the United CEO, you saw people celebrating on both sides of the aisle, people that believe in gun control celebrating this. And while I 1000% don't condone murder, I think it was a collective societal moment where we realized how pissed off people are about healthcare. People saw cracks during the pandemic, whether you thought it was a real scary pandemic or a little overblown. You still saw our healthcare system do amazing work, but also really, in the early days, we didn't have the support, the medical equipment that hospitals need. We didn't know how to track viruses, healthcare workers that were treated horribly. A lot of people, I think, really saw the cracks in the system and are starting to see this as a system that's not working for us. So those were a lot of nuggets I just put in there, and maybe more than you wanted, but you just made me think of all of these things that we hear from people all the time, and support during the postpartum period is one of them as well.
Yeah, there's nothing more that I love than a good brain dump. So let's have it. One of the things that I think people are really waking up to is the lies and manipulation of the systems that we have. And I think a lot of people are feeling taken advantage of. And that's one of the reasons that they really just want honesty and transparency. I think the American people are just so tired of being given the runaround in so many places in life from so many industries. We just want you to tell us the truth.
Yeah.
We'll be able to do what we can with that. Okay, so I have a controversial question, and maybe you don't want to answer personally, maybe more on a professional level. I really don't care, but do you think universal health care is the answer for our country?
I think our mission for our organization is that everybody should have access to quality, affordable healthcare. And so the concept of universal healthcare, absolutely. I do think it is a human right. I think the question is, how do we get there?
Especially in this country, right? It's very hard to mimic what other countries do
Yes.
because our country is so different in a variety of ways.
Yeah, and and I work in healthcare and health policy. I have my whole career. Nobody that you talk to inside of healthcare, outside, would say we would build this healthcare system if we were starting from scratch. I
Yeah.
mean, nobody's standing up for that. I think it's a big discussion on how do we get to the right solutions, and can you do it through incremental change? Do you have to burn it down? Do you do it on a Medicare chassis? And so there's lots of different ways that people are debating how to get there. But I think I certainly believe, and our organization was founded to make sure that all people had access to care that they need.
Yeah, I think that's something that most people, and you probably found this in your work, that most people agree to that. Most people agree that healthcare is just a human right. I think where we see the most disagreement is how do we get there? And what you were saying is nobody agrees that this is the system we would build. I don't know that anybody actually has the right answer to how to get that employed and dissipated out into our country the right way the first time. I think this is going to be something that over the years and maybe even decades, we have to continue to shift until we hit the right balance of how do we make it affordable for the people? How do we make it sustainable for our country to actually afford? And then how do we actually get good, solid health care to every single person in our country that actually improves results and outcomes and makes us a healthier country? Because there have been programs in the past that was their goal, but it didn't do that. That's not
Yeah.
what we saw. We didn't see the improvement in health. We didn't see the improvement in outcomes. And so I do think there's a large and deep kind of dig of skepticism by a lot of people.
Yeah.
Fortunately, in a country of billions of people, we're not going to get it right every time, but you have to give credit where credit is due. And for the programs that are trying, all we can do is try, reevaluate, and re-implement in a better way so that we can hopefully make it better next time. And I think people feel really frustrated with that, but it is the only answer. Very rarely are you going to get it right the first time with the number of people that populates our country.
Yeah, I think that's right. And I think there's been a lot of incremental improvements. I think there's been a lot of big step improvements, like through the Affordable Care Act. And we have an administration right now who's really focused on how to make people healthy. And I think there are a lot of people in this country. I don't think many people would disagree that we shouldn't be healthier in this country. I think, again, it's how do we get there and how do we make sure that we're using science-backed evidence to make sure that we are as healthy as we can be.
Yeah, absolutely. Oh my gosh. Okay, you're speaking my language. You mentioned your 100 Weeks project. I want to hear a little bit more about that. What does an ideal world if your 100 Weeks project was just universally across our nation accepted and implemented? How would that impact families and what would that look like for women and children?
Yeah, it's a thing. I'm glad we're bringing it back to this. As I said, our 100 Weeks project really is to support women from conception to a year postpartum. And it's really a framework based off of going out and talking to women and families across the country. What is working, what isn't. Our team just put out an absolutely beautiful journey map that is, in a very unique way, tracking the journey of what postpartum should look like based off of clinical recommendations, based off of evidence, and overlaid that with the experience that women actually have told us they have. And so we'll make sure that the audience has access to that link. It's a beautiful document that really highlights the experiences, the emotions, the real life examples of women as they are postpartum. And for that, why we did that was we really wanted to bring the human aspect to this postpartum period discussion. We wanted to not just leave it up to what is the clinical recommendations or the research show us, but what do we hear from women? And so that's a beautiful journey that is beautiful visually, as beautiful as you think about new life coming into the world, and is also heartbreaking as you think about some of the experiences that women have. And really, then we put out a vision for postpartum health based off of this listening, based off of what we know can go better, usually through insurance, because we know how you get care in this country is through insurance paying for it. Is what would this look like if women had the support that they wanted and need in that year postpartum? And so, as we've talked to women, it really falls into some simple buckets, but I think a great framework for how we think about moving forward this issue. Number one is women really want personalized care that fits their specific healthcare needs. We can be thinking now in that case we can think about the kind of ongoing provider visits that we know women need after the baby, not just that one visit. As many as 40% of women don't attend a postpartum care visit, and that all depends on the insurance, et cetera. I know some women even think of their pediatrician's appointment, the pediatrician as the one that's like checking up on them and asking if they're doing okay. So we're really seeing a real need to expand the number of postpartum visits that women have, interdisciplinary teams that include doulas and midwives and community healthcare workers that support the clinical model, and really making sure that women have this information that they need. So that's all in that number one bucket, and I think gives a really good framework to what we should be thinking about in terms of, again, it's not a sexy tool of insurance coverage, but it is how we get things done in this country. So then number two is comprehensive whole person care that women told us that they want, that helps treat them as a full body, not different body parts, but really their whole well-being as one and not just symptoms. So that's looking at screenings that really look at the underlying things that might be going on in a family's life, like food insecurity, as we know that social needs have a real impact on women's health, and screenings for mental health and referrals out to make sure women have what they need. Maybe this is a place where we can have at-home visits and virtual care options, et cetera, and not making the woman bundle up that little baby, put them in the car, try to make it through to an appointment, but really, how can we center the woman's needs? And that would mean coming to my home. I can guarantee you, as a mom of four, And then number three is an understandable system that's easy to navigate and allows moms to have the support that they need. So that could be community-based support and resources, group education and classes, breastfeeding supplies and resources. I have a stat that of women who stopped breastfeeding before they wanted to, 20% of those women did so before 6 weeks postpartum because they didn't get the support that they wanted. And then, of course, comprehensive postpartum care plans and making sure that's a part of the clinical visit or midwifery visit. And as I think about having the kids that I've had and the postpartum period that I went through, of course, with all of them, these would have been so helpful. It's so important to make sure that myself and my new children, my existing children, my husband, we had what we needed. And then this is all to say if you're a woman who's lost a baby in pregnancy or during labor and delivery or afterwards, these are even more important. And we often forget that women, if they don't have the baby in belly or the baby in arm, that they don't need this support, and it's more important than ever. And that's a real big part of the discussion we're having with leaders and employers to make sure that's really seen as not only a horrible situation of loss, but one where the body is still going through postpartum. So this is a vision and roadmap that we've put out there that we're talking to leaders about, we're talking to employers about, whether that's or Medicaid plans to make sure that this sort of vision comes to life for women.
I love that so much. I think so. I do a lot of work with lost moms as well. And I think that is even more forgotten than the postpartum
Yeah.
period. And it is a tragedy on top of a tragedy. It's really horrible. You
Yeah.
have had four babies, and
Yeah.
you just talked about a lot of things that in an ideal world would really change our lives. It could just skyrocket the health of women and families in this country. What
Yeah.
were some of the things when you look back on your postpartum periods that you didn't know were available to you and you wish you had, or you found out after the fact and you realize, like, darn, that would have been so pivotal for us if we had known? What were some of those things that women listening, you want them to know? These are available to you, these resources, these people, these services are available to you.
Yeah, I think so. Some of these are a point in time, but really show how important policy is to this. They're for I think my first two, and my first one was born in 2010, before the Affordable Care Act was really like, it was passed, but it was not in place. Then there wasn't lactation. We didn't get free breast pumps. And that is now, of course, out there, and I think very well known, but taking advantage of that and making sure that you're getting and the advances that have happened on breast pumps. I'm like, oh my gosh, like I carried this suitcase with me. And now they're like teeny and battery operated and discreet. So looking into how can you best find the lactation support that you need, both if you're doing direct breastfeeding, if you're pumping, if you're using formula, like making sure that there are so many resources out there to make sure that you have what you need and really making sure you're taking advantage of that. I would say if I think about the list of what would have been really helpful for me is having more of those appointments. My first son was premature and in the in the NICU for a month. I went home. It was awful. Like I said, I didn't have baby in belly or baby in arm, and I felt like a total failure. Like my body just completely failed to do what it was supposed to do, quote unquote, and carry a baby to term. And I am quite sure I didn't have one checkup for me during that. I'm trying to remember if I did. I don't feel like I did. And that is important always. But if you think about a mom who has a baby in a NICU, I was so upset. And I don't know if it was clinically depressed, but I was not in a good way. I was waking up at 2 a.m. and 6 a.m. and to pump to make sure that I could bring breast milk to the hospital every single day. So when he was able to get that he could eat, he could have the best nutrition that I felt for him. And that meant taking the city bus across town to the hospital because it was too expensive for us to park there. And that meant I wasn't healing. I was walking on my feet, walking up to the hospital, sitting down on these horrible chairs, like not physically healing. And I don't know if anybody was checking in on me besides my loved ones from the healthcare system. And I think if anybody is listening to this, perhaps and going through it, making sure that we're prioritizing our bodies, and even with or especially during, trauma or a tough time, but we should always be, I think is something that would be a message to folks to make sure that you are, before you have the baby, that you're talking to people to make sure that they are prioritizing your physical needs, your mental health needs, as well as the babies. Because even in the best case scenario, and I had some really great other births and postpartum, you still are the forgotten one and you're taking care of other babies or the baby that just came out, and then it can be a really exciting time, and it's an exhausting and scary and lonely time as well. So reaching out and having a plan to how do you make sure that you're getting the care that you need and not just caring for everybody in your community, I think is a really important lesson that I learned and I know many other women go through.
Yeah, I have three resources to share with you guys too to piggyback off of that. If you are a NICU family, the March of Dimes is a free and national resource for anybody who has a baby in the NICU. All states have a March of Dimes sector or branch, so you can reach out to them. Every hospital should have social workers on staff. Your smaller kind of community hospitals may not have them all the time per se, but don't be afraid to ask for a social worker or some sort of support for that. And then PSI, it's Postpartum Support International, is also a free national resource for people. They have a hotline. So if you are really struggling and you need somebody in that moment, I know mental health services are really sparse these days and it's very hard to get in, and insurance coverage is convoluted, and there can be a lot of barriers to getting mental health support. But PSI, Postpartum Support International, you can Google it. Their hotline will come right up. And there's always people there to answer the phone to talk to you. So if you are needing support, those are three really great resources for you, especially for families who have unexpected birth stories, whether that be a NICU stay or just unexpected birth trauma. You can reach out to those three places.
Those are great resources.
Yeah. So, Natalie, I have a question about current legislation that's happening in our country. Are there any pieces of legislation that are really pivotal, either negative or positive, that we should be keeping our eye on and possibly getting involved?
Yeah, as we started the conversation, any changes, any negative changes to Medicaid, you can't talk about women's health without talking about Medicaid.
Yeah.
And so calling your representative, making sure that they understand how important this is for you and for your community, and that they should not go backwards on such important care is the biggest one to be watching for. What we mentioned, the Braidwood versus Kennedy, which is an important Supreme Court case that very little people know about, but that's another one that you can make sure is on the radar of your members of Congress, of your governors, to make sure that their voice is being heard about that. And it's hard to talk about some of the positive policy steps forward because on postpartum, because so many have taken place through the Medicaid program. Like I said, 40 states have expanded postpartum care to 100 weeks. There's a new kind of model of care through CMS with 14 states to help meet some of the gaps of postpartum care at large. But a lot of these could go away, and there are bright spots for sure, but many of them are at risk right now as we think about potential cuts to Medicaid.
Sure. Well, another thing that I want to touch on before we wrap up is you have brought up many times virtual care. In 2018, I started to offer virtual dual services, and I faced a ton of pushback. People just swore up and down that virtual doula care would not work, it would never work, you can't be someone's virtual doula. And obviously, as a firstborn daughter and a 3-wing 2 Enneagram and a strong-willed Aries, I didn't care. Then I said, I don't care what you say. You don't have to do it if you don't want to, but I'm doing this. And it has been wildly successful. And then just 24 months later, we had a pandemic, and everybody had to shift to virtual care. And while everybody else was fumbling around trying to figure out what to do, I had a smooth system because I had already done it. I already knew how to do it. And it was for me so comforting and validating to know that there is an answer for people who don't have in-person access, or maybe your nearest doctor's 3 hours away, or maybe you live in an area where there really isn't a mental health counselor in person, or maybe you don't have doulas actually in your area, and so anybody that you would hire would have to add on a travel fee. There's so many healthcare deserts out there. Over half our country is a healthcare desert, and so it really impacts access so much. What kind of positives are you seeing from virtual care, and what's the data telling us when it comes to improved access and improved outcomes for the women and children in our country in terms of dissipating this virtual care across our country?
Yeah, it's so fascinating to hear you say that I haven't talked to a doula virtual care company the way that you described it, and that's amazing. And I think you're exactly right. The pandemic really showed us how much can move to a virtual setting. And as we've talked to people across the country, there's a real desire to have a blend where you can have it in person when you need it and virtual when you want it. And that looks different for everybody, and it looks different depending on the location that you're in, what you're looking for the care on. And so our message always to Congress and to lawmakers and to insurance companies is to make sure you allow for that blend to account for what people want, because we know that virtual care is such an important aspect of, if we think about the shortages of providers, of we're creating less primary care docs now than we ever have in our country, and we're going to have to figure out a way to not only supplement the shortages in providers that you're talking about, but to also bring innovative new care to people like you are, and to meet people where they are. If you are working and you have a half-hour break or 45-minute break, and that's how you want to use your time to talk to a doula or to talk to your pediatrician or your physician, we need to allow for that to people to have lives that aren't, our lives can't be dictated about the healthcare system and what is paid for and not. And so moving something to be as convenient as possible is really important. And so it's great that your business is thriving that way. And as we, like I said, we continue to talk to Congress, and there's a bill to make sure that we're continuing the payments that allow for virtual care through our insurance that were stood up during the pandemic, and we know now need to continue because it has been such a positive way to get care to people. And I don't have the information in front of me, but no doubt that the access that everybody in our country, for lots of different reasons, has gone up, and with that, the outcomes, if done in a clinically appropriate sort of virtual care way. And so we're making sure that we're advocating for that blend of care to make sure that it continues to be covered, because it is really important. And with the new world of AI, as people are talking about it, and how that's going to be used, that's different. And sometimes that's different than virtual care. I know there's some companies that their virtual care that they give is through an AI created bot or something, and so we're still sussing all of that part out, the AI aspect, but there's for sure some things that can be taken off of a provider load through AI and through allowing for more virtual care.
Yeah, oh my gosh, that warms my heart. I know two stats that really have struck me is that lactation services virtually have been incredibly positive and successful. And we've seen an improvement in cardiovascular results as well with virtual care. Namely, the follow through with people actually following medications and taking their blood pressures at home, because you highlighted it, but it can feel so daunting to get to the doctor when you only have a 30-minute lunch break, whereas you could take a 15-minute call with your cardiologist and check in on your blood pressure and give them an update on how your medication is making you feel and how it's being implemented in your life and whether you need any tweaks to that. I just think, I'm a firm believer in this, and I have been from before it was even cool, but virtual care is the future. And I think that with a country that has such deficits in our healthcare system and access to care, virtual care is the answer for so many people, especially women and children, because we are playing that CEO of home, because we have so much invisible labor, because we have so much mental load. If you can reduce an hour commute to and from in a 45-minute visit that now turned into an hour and 15 minutes because the healthcare system is chronically running late, and then you only get a 6-minute visit, so you didn't even get all your questions answered. It just Virtual care is the answer. I know it is for so much, and that is definitely a hill I'm willing to die on. I will not get off my soapbox for this one. And so it's just really helpful to hear you, and validating to hear you say we have seen an improvement, and it is the way of the future. And
and it's so interesting because I think often we think of virtual care as like sitting on Zoom and talking to somebody, which is important, but it also, you're right, there's so many forms. It can be a text chat, it can be, which I do with my pediatrician, and I'm so thankful that everyone could just text her about and send a picture. And my oldest son was just diagnosed with diabetes, type 1 diabetes in January, and the amount of times where we can just pick up the phone and call and get more information and not have to go in, and it's just those are all examples of virtual care that are so important. So
it really is bridging the gap of the deficits that are our current healthcare system. Just unfortunately, no matter how hard we try, is not able to serve in that way. And so if we're going to fill in these gaps, virtual care is a really great and accessible and affordable way to do that.
yeah.
Oh my gosh. Natalie, this has been such a cool conversation. I walked away with so many nuggets of wisdom that I did not have previously. I really appreciate being here. If people wanted to get involved with your missions, if they wanted to get involved with their local legislation through your programs, if they wanted to learn more about United States of Care, how can they do that? Where can they learn more? And how can they connect with you?
Yeah, great. UnitedStatesCare.org is our website. You can pop up there and you can click on a Preventive Services Resource Hub to learn more about the Braidwood case that I mentioned. You can click on our 100 Weeks project to dive into those beautiful resources of whether that is our journey map, or I can't even believe I didn't mention before this, we have a map of the health of postpartum women per state in every single state, and what is the 5 really important indices and what does it look like and how is the state doing. That's a great place to look and see how your state is doing, and where you can go and talk to your legislator and say, look, we are the worst at postpartum mental health support, et cetera. And so click into that. You can find me on LinkedIn. That's where I do a lot of my writing. And then our organization has an X account, United States of Care, or also on LinkedIn. So lots of places. And finally, you can suggest signing up for our newsletter. It won't spam you. It's every 2 weeks and just chock full of really good resources, really good breakdowns of what's happening, different legislative aspects of the healthcare system, where some bright spots are. So I think it's another great resource.
All right, you guys, we'll obviously link all of this. And if you've been following me on social media, you know that I am becoming more and more involved in the legislation across our nation. I started with Count the Kicks for stillbirth prevention, and now I'm working on a couple of initiatives in a couple of different states to expand midwifery care. And I could soon see myself being part of this legislation as well. It's really, really important for you to be involved in your local legislation, you guys. I can't tell you enough. And look, that is coming from someone who I've never cared before. I did not pay attention in high school history classes or government classes. I never opted for those electives in college because to me, I was like, what's it matter? I'm not going to be in government. I don't care. It doesn't impact me. What's my one little measly vote matter? But I can tell you it does matter. For every person that calls your representatives and says, I'm a constituent, this is important, please make sure you vote for this, please make sure you stand up for this, please make sure you pass this or you don't pass this, it matters. You may not feel like your voice is heard, but you absolutely are heard. So please get involved, connect with me. I can connect you with the legislation projects that I'm working on. Natalie can connect you with the things that she spoke about and that are important to her organization. And if neither one of those float your boat, I know that there's an organization and a legislative project out there that will float your boat and will make you feel empowered and jazzed up to get involved. So please, please, please don't hesitate to get involved in your local legislation and in politics. And you don't have to do it in a combative way. It doesn't have to be something that makes you feel like you are crossing party lines or being, I guess, adversarial. A lot of people really stray away from politics these days because there is a lot of tension. But the best thing that you can do is go in there and help people feel needed, feel heard, feel supported, feel safe. And I know that so many of my listeners are the right people to do that. So take this as a little nudge if you've been feeling that pull to do that, but you have been on the fence. I want to be the one that pushes you off the fence and to encourage you to go out and do that. All right, you guys, I'll see you in the next episode. Be sure to follow Natalie and United States of Care on social media. You can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye.
Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.